Good morning, good morning! Magandang umaga, America! Welcome to another Tuesday edition of Ano Na Bev, Best Express Views on PHLV Radio and I Want TFC. Hit that subscribe button on all social media accounts of TFC, I Want TFC, PHLV, and at Bev Llorente on FB, IG, and Twitter. On to our Tuesday topic. Obamacare is the country's largest expansion of health insurance since Medicare and Medicaid in 1965. Recently, North Carolina became the 40th state to agree to expand Medicaid under Obamacare. So this means 10 states have not adopted Obamacare. This includes Texas and Florida. It is estimated that 3.5 million adults lack health care insurance. It's a super interesting topic because in America, there is no universal health care. The U.S. government does not provide health benefits to citizens or visitors. Anytime you get medical care, someone has to pay for it. And it's not cheap because it's very, very expensive. So if you break a bone, your bill could be $7,500. If you're hospitalized for 3 days, a whopping $30,000 could put a hole in your pocketbooks. Today on the show, we have with us Fil-Am nurse practitioner, model, and an advocate for human beings' well-being. Ladies and gentlemen, Miss Cristina Pajara! Welcome to the show!
Thank you, Bev.
Ayan. Cristina, you work for a nonprofit organization who helps the uninsured or those who have little insurance, yes?
Correct.
So tell us about it. What inspired you to work at a nonprofit clinic?
Okay, I have a very humble beginning coming from caregiving. Went to CNA, went to school for nursing.
Yes.
And took my master's degree for family nurse practitioner and went back again for master's in psychiatric mental health.
Wow.
So I have double masters.
So the ladder of
Yes.
nursing practitioner.
Correct. From
diba?
scratch.
From scratch.
I have
from
a-
care, and there's nothing to be ashamed of because
Yes.
it's a noble profession, diba? So yung mga caregivers natin dyan, ng mga kababayan natin all over the world.
I'm very
Hello
proud to
sa
be
inyo.
one.
We love you so much, diba? Ayan. So, tell us about bakit ka napunta sa nonprofit clinic?
So, during my years with as an internal medicine hospitalist, I was geared towards seeing patients that are homeless.
Oh.
So that opened my eyes that I have more things to do rather than just rounding in a hospital, because social aspect of the patients is very important. When they're sick and then they get out, they go back to the hospital because of the social aspect of not being followed through after hospitalization. So the clinic that I work for now is only a satellite from California office. We have
Okay.
2 California clinic that's federally qualified, look-alike, a nonprofit clinic, and this is a satellite in Las Vegas. The founder also have the same advocate. He believes that every person or individual has the right to a health care, and it's not easy to obtain it.
Yes.
So-
So what are the services offered at your clinic and how do these services benefit your patients?
So we offer a family practice. We cater to pediatrics, women's care, pap smear and pregnant women, chronic diseases for adults, and we added mental health for psychiatric needs of patients.
Ayan. And how does your clinic work to provide care to uninsured or underinsured patients?
We have a sliding fee scale
Okay.
for those that belongs to poverty level.
Okay.
If they don't have any Medicaid or uninsured, we charge probably between $20 to $50 per visit,
Okay.
which is really, really low. We follow the poverty
Guidelines.
guidelines for the sliding scale fee, and we cater to all major insurances, especially Medicaid.
Ayan,
patients.
especially Medicaid patients. So what are the and Medicaid are under with Obamacare, correct?
Correct.
Ayan. So what are the challenges your clinic faces in terms of funding, resources, and how are you overcoming these challenges? Kasi you're federally funded, di ba?
Actually, no, we are a lookalike. So
lookalikes.
we are not we don't have a grant.
You don't have grants.
But we get a little help from the Medicaid patients as well as the commercial insurances. So we can bill. We can still bill those visits if they have insurance. And because of this, we're able to offset or help the uninsured by giving them very low cost from $20 to $50. We are applying for grants, and like if there's COVID grants, we qualify, then that gets to help with our operations. It's not easy because we have to also pay salaries for the staff, overhead, our expense, the building, and the way we reach out, we always partner with organizations through outreaches. There's a lot
outreach
of homeless. Yes, there are homeless programs, outreach out there, so that they would know that our clinic exists.
Yes.
So we can give them the medical attention that they need within the underserved community that we are located at.
Ayan. Let's pause for a break, and when we return on the BEV, Best Express Views, Cristina Pajara will share some success stories and rewarding experiences of working in a nonprofit organization. Stay tuned. We'll be right back.
I'm a professional singer. That's how I support myself and my family. I'm a careful driver. The other car hit me. I ended up picking Richard Harris. Richard Harris is already an institution in Nevada. Dahil kay Richard Harris, tanggal ang worries.
I slipped. I hurt my tailbone. They sent me the bill. Si Richard Harris, siya lang ang tumanggap ng kaso ko. Tutulungan ka niya. Kay Richard Harris, tanggal ang worries.
The Richard Harris Law Firm, just in case.
Sabi ng patients ko, they don't need a colonoscopy because they don't feel anything. But colon cancer is a silent killer. It affects both men and women, mayaman man o mahirap. Have your colon checked.
Mobile Home Health, providing care in the comfort of your own home.
Serving Southern Nevada is our top priority.
And it's our greatest joy to help others stay safe and enjoy a better quality of life at home.
Because health is wealth.
Your head is a part of your whole body, just like your heart and the rest of your body. Huwag kang mahihiya dahil hindi ka nag-iisa. I'm your nurse practitioner, Cristina Pajara, advocating for mental health. Educate yourself and others. Choose empowerment. Call today.
We are back, and still with us, the beautiful and pulchritudinous nurse practitioner, Cristina Pajara. So, Tina, please share with us success stories or particularly rewarding experiences you've had in the past while working at the clinic. Like, in what ways does your, how do you say that, feel good story that you are personally proud of?
Okay, when we see patients and they know that we are advocating for them and their needs, Medicaid is not easy because we have to find providers that also accept Medicaid, but we advocate for that. We find services that would cater to their insurance, and even the uninsured. Of course, they have to have money for, let's say, blood work or radiology. So partnering with other organizations that would also help them is very empowering. We get to treat even if they don't have money to pay through partnerships. And they're very, very happy because they bring their kids along with them. And some of the kids, they would also have insurance. And they're just happy that the whole family is being seen in one clinic. It's like a one-stop shop.
Ayan. What about, was there like an instances when one patient came over and he's very sick and then came back again and said thank you to you and give you lots of gifts? Meron bang ganong event?
They actually give us food.
Ayan.
And they just to thank us for the service and the medical attention we gave. There was one patient that came in, and she came from a trip, and we caught from the blood work that she's very, very seriously ill.
Oh no!
We took our time to really reach out for that patient, even if she's no insurance. And we told her to go to the emergency room, and she came back to us. The daughter came back to us saying that we saved her life.
Ayan, what a beautiful story. In what ways does your clinic collaborate with other healthcare organizations or community partners to provide comprehensive care to the patients?
We partner with major insurance companies.
Okay.
We do health fairs.
All right.
Health fairs meaning sometimes we did COVID vaccines, along with eye screening, dental screening, even the Medicaid office. There's a staff that comes to our clinic as a resource. Some people don't know that they might qualify as uninsured. They begin as I see them as a patient that with no insurance and end up having been approved with Medicaid because she applied at our clinic. So on Thursdays, we have a Medicaid staff, and she takes care of the applications. So
and there's no reason to be in fear, regardless of your status.
No, regardless.
Immigration status.
Correct. They will. I think the qualification is they have to have the paperwork and a certain amount of income.
Okay.
Like the poverty.
This is for the Medicaid.
For the Medicaid, yeah.
Okay. But for an individual,
for us, yeah, we don't turn away or turn our backs to anyone.
Okay.
Any race, even homeless.
Ethnicity.
We take.
Yes. Yeah. Okay. So how do you see the role of nonprofit clinics in addressing healthcare disparities and promoting health equity?
Actually, we are supposed to be the support of hospitals. The patient should not really be coming back to the hospital for reasons of, I forgot my medication, I did not take my medication, I did not get a refill of my medication, I have a cough and cold, and it got bad because I didn't go to my doctor. So we're here. We are the gap. We are bridging the gap of that. And most insurance companies love it because, of course, we don't flood our emergency rooms with simple cases. Or if we are to take care of these patients and monitor them consistently, they will not get worse. Health-wise, they should be maintained and healthy, so there's no reason for hospitalization.
It's preventative care, right?
Correct. That's why we are into preventative care. We call them for pap smear because of the cervical screening. We refer them for mammograms. We refer them for all kinds of blood work and diagnostics that they can have so that we can prevent serious illnesses.
Ayan. And can you speak to the importance of supporting nonprofit clinics and how individuals or organizations get involved?
For us, I think just spreading the word out there that we are existent. We exist.
Yes.
We are here to serve.
Yes.
A lot of them probably they have the insurance, but they don't want to come. Some of them is just awareness. Some of them, they already have the insurance, but they said, I'm not sick. But they don't know that we can prevent a lot of things, even if there's a lot of disease that you don't have symptoms.
Correct.
So you need annual checks, blood work. So that's why health fairs are also important, because sometimes we check blood pressures and vital signs in these health fairs, and they have not done it. And then they would realize, oh my God, I have.
It's already
yeah, and
on the final stage of it.
yeah, and stroke.
Yes.
Stroke comes from no symptoms. It just
Silent killer.
it's a silent killer. If you don't know that you're diabetic or your cholesterol is high or your blood pressure is high, and you say you don't feel anything, that's when the stroke strikes.
Ayan. So, to our kababayans out there, especially in Las Vegas, there's a lot of Filipinos out there probably lost their job, lost their
Correct.
income. So, invite them. Encourage them, and let's advocate that it's not embarrassing to be seen,
Correct.
in a very small amount of money for your services, correct? Because
Yes.
you are available. There is help is there.
Correct. Hi, to kababayans out there. We are here to help. I've helped a lot of Filipino that does not know that they qualify for insurance. They came to my clinic, and they were helped by Medicaid office, and now they are able to get the blood work that they needed for years and the diagnostics that they need. We are also here to help with your medication refills, personal medical checkup. Don't be shy because you don't want to wait until when you hit 40 and above. That's when everything goes haywire. Don't wait because you don't feel anything. It doesn't mean that you don't have anything.
Ayan. Thank you very much, Cristina. What a delight to have you. I enjoyed our dialogue on the future challenges and opportunities faced by nonprofit clinics as well. Thank you for that insights. Ano pa? Your clinic, and let's flash your clinic, diba?
Yes.
Aghaby, what's the
Aghaby
name?
Community Comprehensive Health Center is located in 1845 Civic Center Drive, North Las Vegas. So we're easy. We're easy access. So let us know, and we're here to serve.
Ayan. Thank you all for tuning in, and I hope you have a fabulous week ahead. Stay active, stay healthy in body and in faith. See you again next week, mga kapamilya, for another edition of Ano Na Bev, Best Express Views.
I'm a professional singer. That's how I support myself and my family. I'm a careful driver. The other car hit me. I ended up picking Richard Harris. Richard Harris is already an institution in Nevada. Dahil kay Richard Harris, tanggal ang worries.
I slipped. I hurt my tailbone. They sent me the bill. Si Richard Harris, siya lang ang tumanggap ng kaso ko. Tutulungan ka niya. Kay Richard Harris, tanggal ang worries.
The Richard Harris Law Firm, just in case.
Sabi ng patients ko, they don't need a colonoscopy because they don't feel anything. But colon cancer is a silent killer. It affects both men and women, mayaman man o mahirap. Have your colon checked.
Mobile Home Health, providing care in the comfort of your own home.
Serving Southern Nevada is our top priority.
And it's our greatest joy to help others stay safe and enjoy a better quality of life at home.
Because health is wealth.
Your head is a part of your whole body, just like your heart and the rest of your body. Huwag kang mahihiya dahil hindi ka nag-iisa. I'm your nurse practitioner, Cristina Pajara, advocating for mental health. Educate yourself and others. Choose empowerment. Call today.
Just like a friend from back home. This is your Filipino radio experience in Las Vegas. PHLV Radio.